Hello, Dr. Keith Smith with you again from Surgery Center of Oklahoma. I wanted to wrap up the repricing in the last blog and supplement it just a little bit with some more information, maybe help the idea stick. It's very counterintuitive, and I thought that this supplemental follow-up blog may help. One of the great lies that brought us the Unaffordable Care Act was the notion that these giant hospitals whose emergency rooms were full of the uninsured were going to bankrupt these hospitals, and that they needed to pass on all of these charges for which they were not compensated to the rest of us. And so the idea was, if we got everybody insured, that everyone else's health care would become affordable. I knew that was a lie at the time, and after now that I can tell you I understand this uncompensated care scam, it should make sense to you that in front of all of these emergency rooms that are supposedly the loss leaders driving these hospitals to the brink of bankruptcy, in front of almost all of them, it seems like there's a crane building on. And I don't know of a businessman who would build onto his loss leader. It makes no sense. Hospital systems are actually building freestanding emergency rooms, and so none of this holds water. And once you understand that, to the extent that these hospitals can claim these losses about which they complained and which largely is responsible for bringing us this Unaffordable Care Act, with these losses they actually make more money. That perhaps will help. That example, I thought, might help you understand better this uncompensated care scam and what it has led to. The other point I want to make is there are good repricers and there are bad repricers. There are companies that step in to keep employer health plans from being bankrupted by hospital charges, and those people charge for the extent to which they can achieve a discount on these bills. And those are the kind of the good guy repricers. The bad guy repricers are the ones who actually seek out the most gigantic bills they can find. The big carriers, they don't want any part of reasonable pricing like what we have at our facility, because there's no repricing opportunity. There is no opportunity for a carrier to make money off of a claim at the Surgery Center of Oklahoma that's listed online and about which no one is going to fight or argue. I wanted to bring these 2 points to you to supplement repricing. I'm interested in any questions that any of you have. You can email me. My email address is on the website, and maybe I can address some of your questions on future video blogs. Thank you for joining.